We are going to use ultrasound initially to identify the posterior iliac crest. And this is, again, with a curved transducer, just because that's the way I was brought up around the pelvis to use curved transducers. Can be done with the linear. And on the screen here, we can see this mountain. That's the posterior iliac crest. That's all we have to identify because we want our needle to come right down the 50-yard line there. Once we identify that, we know we're safe. And that little plastic tube is just meant to show the path of our Jamshidi needle and also the path of our spinal needle initially to get down to the cortex. So we've got that identified on the screen. We get that in the middle of the screen, which means it's in the middle of the transducer. We spray ethyl chloride. We move the transducer so we don't spray the ethyl chloride on the transducer. And then with a 22 gauge spinal, we go straight down to bone. We're talking it's maybe a couple inches in most patients. This syringe has just lidocaine, or it can be a lidocaine-marcaine mix. And after putting that down in the subcutaneous tissues, we then go away for 5 minutes. Really important not to jump into the procedure. You have to give that local anesthetic time to set up. We then make a little incision with a scalpel. This is not meant to draw blood. We're not going down. Please don't go down to the posterior iliac crest with that scalpel. Just nick the skin. And then we take our Jamshidi down to bone and we make sure that we're right over the crest of the posterior iliac crest, right over the apex of it. And notice I'm not using a drill. Notice I'm not using a hammer. This is today. This is real time. I've never used a hammer or a drill. Doesn't mean I don't have them in the office just in case. But what you'll see, and again, this is real time. This is not sped up. This is not spliced, or there's no George Lucas, LucasArts magic here in the post-production editing. This is real time. And the real amount of time it takes to do this with my hand to go through the cortex was 41 seconds. There we are. That was it in real time. So without a drill, without a hammer, which means we're not banging on this poor woman's pelvis, we have gotten into the posterior iliac crest. We take out the needle. We mention to the patient, you're going to feel a little bit of pressure change. And now we can go ahead and get the bone marrow aspirate. So this is all done with ultrasound guidance. We've eliminated the need for fluoroscopy. We've eliminated the need to go to a special procedure room. This is done in the room with the patient because we're set up to do it.